Your patients who have high-risk non-muscle invasive bladder cancer, there's kind of a couple real key things in that population. One, most of them are going to have recurrences at some point. Most of them won't progress, but a small number will. Their follow-up currently is pretty invasive. We look in their bladder with cystoscopy usually every 3 months, maybe every 6 months, until they do have one of those recurrences. And so there's a couple major things that that patient population needs. One, non-invasive testing that could accurately detect whether or not they have disease would be really helpful. But the other thing is, can we find a way to sort of determine who's also going to maybe be at risk of progression, who is going to benefit from what treatment when? Those things are all still real important questions in the field that we're just starting to address. So the rationale for this study was that if you are looking for a patient population that does not have a high tumor burden, right? They no longer have that original tumor that is going to be high volume and potentially releasing a lot of cell-free DNA. You're now looking in what's called the minimal residual disease setting. And that's kind of similar to an early recurrence where you don't really have a lot of tumor there yet. So the rationale for this study was that if you take this population of high-risk patients that have an original tumor resection and then are already going to undergo a repeat resection as part of their standard of care, you have in essence a population that should have minimal residual disease, and you can really evaluate whether or not this test works. You can then probably, but you would need to do the studies, extrapolate that this will then also work in sort of early recurrence. And so the thought was, here we have a population, we know a number of them will have residual disease. It'll really be a good way to demonstrate the power of the test and really define how well it works.